Dr. Epps, I want to spend a little more time talking about facelift.
Absolutely. This facelift is, just to cut to the chase, is one of the best procedures in plastic surgery. When you think of a plastic surgeon, when you think of Beverly Hills, you think of facelift. And so let's talk about the stigma attached to surgery and why people might choose medical spa treatments over surgical treatments, even if it may be more cost effective, less downtime, and have a long result.
Yeah, I think those are the three things, the fears that we're trying to overcome. We don't know exactly what it's going to look like. We think of it as really expensive, and we're nervous about how long the recovery might be. So help us debunk some of this.
Well, so first, I highly recommend, if you're going to have a facelift or facelift consult, that you seek a surgeon who has extensive experience in facelift and has the training that is specialized in facial surgery. There are multiple types of facelifts. There are small, scar, there's the New York, there's the Max, there's extensive deep plane facelifts, but it should be tailored to the person. But the first thing most people are concerned about is what's downtime.
Yes.
And downtime is really up to the patient. But if you follow the instructions and the surgery is done appropriately, the downtime is very limited. The scar, when done appropriately, should be hard even for a hairdresser to find.
Wow.
That's the other thing people worry about.
Yes.
And so that scar tends to run right in front of the ear and just behind this little part of your ear called the tragus, and then back along your hairline. Now, the third thing is cost. And what you'll find is that a facelift alone, if you divide the time that it lasts, which is usually 10 to 15 years, with a tuck-up maybe at 5 to 7 years with some kind of a procedure, is somewhere around $1,000 a year. Well, most people spend more money on that than they do their Botox. And so that's something to consider.
It really is. And I think helping us kind of walk through some of those, you can come in and really find out what that's going to look like for you, but you helped us kind of work through some of the big ones. Dr. Epps, thank you.
Thank you.